must be my new patient. Yes, I'm Dr. L. It's nice to meet you. Yes, make yourself comfortable. Certainly, yeah, you can take your jacket off. Today's just going to be a quick new patient visit. I'm going to review the chart that your previous physician sent over. I might have a couple of questions for you, so if I do you mind if we just go over a couple of things? Okay, that's good. Alright, and can you just confirm for me your name and your date of birth? Okay, perfect. And do you prefer to go by any nicknames, or is that the name you prefer? Okay, I just want to make sure you're comfortable here. Okay. And okay, my nurse did note here that you're looking to have a cranial nerve exam done. We can certainly do the shorter version of that here, and then if we have any concerns from the results, we can order a larger one, or if you're not satisfied after we kind of complete the briefer version, we can go ahead and order like a longer, more in-depth review. Do you mind if I ask if there were specific concerns that led you to want to have that done? Okay, yeah, sure. Okay. Have you had any changes to your diet? Any life events that might create excess stress? Anything like that that you can think of? Okay. I also have a list of medications here that you've taken over the years with your previous physician. Do you have any changes to medication? Okay. How many milligrams of that are you taking, or how many pills? Okay. Does that seem to help with some of those issues? Does the painkillers, the ibuprofen, does that seem to help with your headaches, or you don't notice a difference? Very minimal difference? Okay, all right. Okay. Let me see what else we got here. Okay, so just looking at your family history here, do you have any concerns about cancer, heart attack? Okay. Okay. All right. No. Looks like your blood pressure was 106/94, so that's pretty good. So healthy. Okay. Just see if there's anything else here. Okay. Why don't we go ahead and we'll get started with that cranial nerve exam. I'll make notes on this as we go. And then if you, like I said, if you want a more in-depth cranial nerve exam, we'll do a really brief one. It's going to be testing your vision, depth perception, sensitivity to light. But if you want a more in-depth version, certainly we can order that. We'll just kind of see how this goes, and I can kind of evaluate my concerns if there are any. And I'll probably ask you a handful of questions as we go as well, okay? All right. So, test your vision. And I'm just going to jot down on your chart here a handful of letters. So, can you tell me this number here? Okay. What about this letter? Okay. And this number? Okay. What about this letter? Okay. And this letter? Okay. What about this number? All right. And back to this letter. Okay. And what about this number? Perfect. This number? Great. This letter? Perfect. And this letter? Okay. Do you wear glasses or contacts? Okay. When's the last time you saw an optometrist? All right. The next thing I want to do is go ahead and test your vision in regards to colors. Okay, what color is this? All right, and what color is this? Okay, how about this one? Perfect. And this one? All right. Okay, next we're going to do something a little bit trickier. So what I've done is I've flip-flopped the colors of the markers and the caps. So I just want you to tell me whether you can tell the color of the marker or the cap when I point to which one, okay? So here, what color cap is this? The cap. Okay. And what color cap do you see here? Okay. What color marker do you see here? The marker itself. Okay, perfect. And what color marker? Great. And the cap? Perfect. What color is the marker? Okay. And what color is the cap here? Great. And the color of the marker? Perfect. And the color of the cap? Perfect. Just the marker? Great. And again, just the marker. Okay, good job. Set those down here. Okay, the next test is going to be a test of depth perception. So I'm actually going to kind of be evaluating your eye movement at this time. So I'm going to go ahead. What I'm going to do is I'm going to take this pointer here. I'm not going to get too close to your face. I'm not going to touch your face. But I simply just want you to follow the tip of this little, the ball on the tip of this, okay? So I'm just going to move this. Go ahead and follow that with your eyes. Okay. Go ahead and follow the tip with your eyes here. Great, thank you. All right, and just keep following that. Perfect. Wherever that goes, that's where I want your eyes to be. Good. Okay, I'm just going to move this slowly up and down. Go ahead and keep following that with your eyes. Okay, side to side. All right. Okay, what I'm gonna do now is I'm gonna start kind of pushing this towards your face. When it gets so close that you feel like you're going cross-eyed, then I want you to tell me too close, okay? All right, so go ahead and just take a look at the tip here. Okay, again. Okay, perfect. One more time. Okay. What I'm going to do next is I'm going to take the pointer and I'm going to have it probably about 5 inches from your face. I want you to look directly at my nose, and I want you to let me know when the pointer leaves your line of vision. Okay, you can no longer see it after looking directly at my nose. Okay? Alright, so look at my nose. Perfect. Let me know when that leaves. Okay. Again at my nose. Perfect. My nose again. Great. One more time. Okay. So I'm going to go ahead and I'm going to hold this a little further away, about 10 inches now. Same thing. Look at the tip of my nose. Okay. And this side. Okay. Just the tip of, just the very tip of this is when I want you to tell me you can't see it anymore. Perfect. At my nose. Perfect. Thank you. Okay. All right. Good job. The next thing I'm going to do is I'm just going to have you follow this as I move it around. And again, I'm just going to be looking at your eyes and kind of the movements they make. So just follow this wherever it's going. Okay. All right. Great job. Okay, perfect. All right. Almost done here. All right, great job. Good job at that. All right, the next thing we're going to do, I always like to make sure that you're comfortable with it. It's going to be light sensitivity. So I am going to take a pretty bright light. I'm going to bring it, same thing, we're kind of testing your light sensitivity and your vision. I'm going to be bringing it in and out of your line of vision, kind of checking on your pupils, dilation, things like that. Are you comfortable with that? Do you feel like the lights gives you headaches or anything? Okay. Again, it's going to be a really bright light, so I am going to shine this. So again, I'm going to bring it in and out of your vision. So you just let me know if at any point it becomes uncomfortable, okay? All right, so I'm just going to take a look here. Great job. Great job. Just keep looking straight. You can look right here at my nose again. We'll be sick of it by the time we're done, I'm sure. Good job. All right. Not too sensitive to that light, right? Okay, great. Kind of similar to what we did before. Okay. Just gonna take another look at your other eye here. Great. Okay. Kind of similar to what we did before. I want to go ahead and kind of put this in your line of vision, and then you let me know when you can't see the light anymore, okay? All right. I'm going to hold this much farther away than before, though, okay? Okay, so you tell me. Okay. Okay, great job. Okay. All right. And one more time. All right. I'm going to check one more thing here in your eyesight. Okay. Now I'm going to hold it kind of behind my fingers here, and I want you to follow it with your eyes. And again, I'm just going to be kind of monitoring your eye movements, all right? Is this a little less bright, a little less sensitive on your eyes? Okay, that's good. Keep just following that light. Try not to give you the straight shot of that, okay? Great job. Okay, now what I'm going to do is I'm going to bring the light in on either the right side or the left side, and the top or the bottom, and I just want you to let me know which side you're seeing it on, okay? Okay? All right. Great job. You don't see that one? Okay, let me try again. There you go. Good job. That was easy. How about now? Okay, how about now? Okay, great job. We won't bother your eyes too much. I'll let you readjust here. I'm going to make a couple more notes. Okay. All right. So a couple of things from that. As far as your overall health for your annual exam, you're in great health. I don't have any major concerns. As far as the headaches and sort of like eye tenderness or around the eye tenderness here, from what I'm gathering, your vision is not 20/20, which we already knew because you do wear contacts or glasses. So that doesn't surprise me as far as like your vision. I would recommend you go and see an optometrist or an ophthalmologist just to have your vision rechecked, since it has been a little while. A lot of times if we're wearing the wrong correction lenses, then it's going to give us headaches and can cause our eyes a little excess strain. So I am going to recommend you go and see someone there. If you need a referral, you can call the front desk. They'll gladly write you one up, but typically you don't need one. Your vision or eye movements, I can tell that the muscles are slightly strained, and again, I believe that this could potentially just be from you wearing corrective lenses that aren't the right prescription for you. I don't have any concerns with your peripheral vision at this time, and the light sensitivity didn't seem to affect your pupils in any unusual way. So I'm really happy with how that turned out. Colors, and you're not colorblind, obviously. You have pretty good vision when it comes to that. Again, I think there's also the potential that this could be sinus related. If that's the case, that could be stemming from allergies. It could be stemming from some other underlying issue with sinus swelling. And after you see your optometrist or your ophthalmologist, we can certainly see if we can get you into an allergen specialist, and they can kind of run a couple of tests, see if that's kind of where this is all coming from as well. But other than that, I'm happy with how everything is. Do you have any questions for me? Okay, sounds good. Up at the front desk, go ahead and book an appointment to see me again in 6 months. I'd like to follow up after you see that optometrist, and you call our office with any questions, okay? All right, bye-bye.